Hi everyone, how you doing? Today, let's go behind the scenes and look at some of the cases that we've seen recently where the treatment has been started really suboptimally. Okay, and I think that's the gentlest and most respectful way of describing these cases, and you'll see why in a minute. And you might have guessed that a lot of these cases have been done in countries abroad where they advertise really cheap dentistry, but not every single case has gone down that route. Okay, you might be surprised at one of these. So I'm going to start strong with one case which we saw very recently where so many things have been done badly, but I can understand why this guy got things done where he did. And if you look at this case, his biggest complaint was the thickness of the white behind the teeth. Now, in the advertising for this clinic, they say that we use Straumann implants. They say that you'll get a zirconia all-on-4 bridge, or in this case, he's got 6 implants. And all of these things are technically true. These are Neodent implants. Now, they're not bad implants, okay? They are good implants, and cases that I've done with Neodent 10 years ago are still going really strong. So it's a good implant, but to say that it's a Straumann implant is lying, because although Straumann owns Neodent, it's almost like saying my BMW is a Rolls-Royce because the same company owns it, or my Fiat is a Ferrari, okay? It's just not true. But in the world of online marketing, where all these clinics want to do is create a good perception, they'll say stuff like this. And also, they'll say that this is a zirconia bridge. Yes, it's a zirconia bridge, but there are so many compromises in this bridge that it makes it pretty much unusable, in so much that this guy was ready to spend a lot of money for us to replace almost everything. Now, let's have a look at what's actually going on with this bridge. I've covered the thickness of the bridge already, all right? That's affecting his speech. It doesn't look very nice, and he's got this constant itching feeling underneath the bridge. The reason for the itching is what's called a ridge lap. So you can see on this photo that there's this curve on the inside of this prosthetic bridge. And the reason this is so important is that it creates an area which is completely impossible to clean. Remember, this is screwed into position. Once it's screwed in, you're never going to get any floss underneath there. It's just impossible to clean. Compare this to a typical bridge that we would do, where you've got the bridge like this, and then you've got the gum like that. Okay, it creates this little horseshoe contact all the way around, which is relatively easy to clean. And even if our patients are unable to actually get a brush in there and clean it, it keeps a very small contact area on the gum. So it's a very small area where any irritation can develop. So why would anybody do this? Let me explain. The fundamental problem in this case is the positioning of the dental implants. Not enough bone reduction has been carried out before the dental implant treatment. Now, in most cases, this would result in a cosmetic compromise, in that you would see a junction line between the natural remaining gum and the prosthetic gum. However, in this case, we're lucky because this patient's lip is so low down. But regardless, they built what we call a flange, which basically covers all of the gum into the zirconia bridge. But in the marketing material, it's a zirconia bridge. Okay, fine. And this has a knock-on effect. Because there has been no alveolar reduction done, the implant positioning is too far inward, is too far in. And that's what's creating this thickness, because it's not actually a thickness from front to back, it's a thickness from the gum down. Okay, so the prosthetics needs a certain amount of thickness, but if alveolar reduction had been done and the implants were placed higher up, this thickness would feel much less. It would affect speech much less. Now, to fix this, we had to get creative. We actually changed a whole bunch of components on the implants. Our discussion was, look, let's try and do the best we can with the implants in the position which they're in. It's not the ideal position, but we might get away with it. I think doing less surgery is always better, and we were able to try this out just in temporary materials. I was able to make the smile look better, but the look of the smile is subjective. Okay, some people like the blocky white look, right? It's not really something that we like. We like to give a bit more individuality, a bit more of a natural smile. However, the look of the teeth wasn't this guy's biggest concern. Now, if things had not worked out, let's say we had made a new smile in temporary materials, changed all of these components, and there was still problems, then we would have been forced to remove the implants, do the implant surgery properly, and then remake the full set of teeth. This is a lot more cost, it's a lot more invasive, and you know, we're cutting again and again. And I've seen patients who have been through this, and some of them have got long-term pain issues, which we can't really get down to the bottom of. This is why I'm such a believer that if we can build on implants which have maybe not been placed perfectly, I think that's a really good solution. Now, let's look at another case. In this case, these implants were placed in the UK. These are actually Straumann implants. They're Straumann zygomatic implants. But you can see the neck of this implant. Now, the story with this lady is that she had the implants placed in the UK, then she went to Turkey to get her lower teeth done, and they've made some kind of temporary bridge, I believe, on the upper zygomatic implants. Now, because they've been messed around with and some components have been damaged, her original dentist doesn't really want to continue the treatment, so she came to us. Now, I think we can rebuild this. Now, this exposed implant, is this a problem? In this case, I don't think it is, all right? However, it doesn't look nice and it's not ideal. Zygomatic implants are actually designed in such a way to expect a bit of gum recession. Here's another case where the gum has receded a little bit, and what you'll notice in both of these is that the implant surface is shiny and relatively smooth. This is a giveaway that this implant is designed to have a little bit of recession, or I should say it's not designed to have recession. If you get recession, it's not that big a deal because the area that's left over is cleanable. It doesn't look nice, but nobody's going to see this because you can't really lift your lip up that high without using your hands. Now, if you compare the implant positioning where we've got the recession to the implant on the other side, you can see that there's a difference. There's this kind of like horseshoe shape of the gum, which the implants could kind of fall into. And if they don't fall into that, the gum gets very thin on the outside, and that's what causes this recession. Now, the implants were placed a little while ago. They've been stable for such a long time. I think, again, it's a little bit overkill to remove the implants and start again. Yes, that's definitely a possibility, but especially with zygomatic implants, it's much more invasive. And if you can avoid it, I think, again, that's a really good option. So in this case, we're going to replace the damaged components which were damaged abroad, and we're going to start fresh and make a fresh smile, improve the aesthetics, and just give this lady a solid set of teeth so she can forget about all of her dental problems. This next one was done in everybody's favorite country for cheap dentistry, and we can see a whole bunch of implants have been placed on this x-ray. But weirdly, look at this one. This one is higher up. This one is not placed fully within the bone. So this is poor implant placement on here. It feels like these implants have been placed very haphazardly. There hasn't been any planning done before the implant placement. Now, typically when we're doing a full arch case, we'll spend about 3 hours, or I will personally spend 3 hours behind a computer planning the exact implant position to what I think is the most ideal position. You don't have to do this. You can just whack in a whole bunch of implants and then put teeth on top. Most people will probably be happy with the end result. And I think that's what's happened here. There hasn't been any planning of the overall smile beforehand. This is how this patient came in and saw to see us originally, especially in the aesthetic region, right on the top at the front here. These implants, the angles are really compromised. It's a really bad angle. We've got away with it again because this patient's got a low lip line, but you can see the final smile that we created for this patient. It's okay, it's a dramatic improvement, but the gums could have been so much nicer had this been planned correctly. Now, in all of these cases, we've been lucky in that we've been able to keep the dental implants which were originally in position. Here is a disaster case, and I really feel sorry for this guy because he spent a lot of his money this wasn't cheap, you know, we're talking plus £5,000–6,000 to get all of this done. And you put this massive amount of trust because the cost of getting this done in the UK is completely prohibitive. He's done this and they've used what's called a basal implant. Now, you can tell this because it kind of looks like a corkscrew and is very haphazard again. Now, these implants are specifically designed to be ultra cheap. There have been dentists on my social media who've got in touch about these implants, and these are dentists who have been working abroad and in the UK, and they tell me that these implants aren't advertised in the UK. You can't really buy these implants in the UK because no implant company is going to sell them here. They sell them as a low-cost option, and they go to these low-cost countries where they can sell them more easily. Now, the problem is they're all just one unit, and all you've got is this piece of metal sticking out of the gum. There's no screws here or anything like that. And this guy had effectively a removable denture, an acrylic denture, the same thing you can get on the NHS. He had that basically stuck in with glue. The glue was going to leave a permanent rough area. We're going to have this ridge lap, which we had in the original case, making it impossible to clean. And being acrylic, it just broke. It's not designed to be fixed on implants, especially not without a metal bar. This is something we use, we used to use as a temporary solution on All-on-4, and we used to get problems then as well. Even expecting it only to last 6 months, quite often the prosthetics would break. These days we use different materials for this and we get much less breakages, but this is a known problem. And this guy had these implants placed. When he came to see me, the bridge kept on breaking. He had to use Fix-A-Dent to kind of glue it in. We looked at the implants. Some of them were loose, some of them were not, and we decided, you know what, this is a proper messed up case. We just need to remove everything. So we removed all the top ones and we made just a removable denture. He's far more comfortable with this, but he's still got the problems on the lower arch. Because this is a random implant which nobody in the UK uses, we had to try and import the instruments to remove this implant. This took about 2 to 3 months in itself. He was in pain all of this time. He was uncomfortable with this removable denture all of this time. However, this was the best solution for him. Now, it turns out a lot of these implants had failed anyway. They were relatively easy to remove. And we're now in a situation, we've removed all of these implants. We're letting this heal. He's not been in touch for a little while, so I'm hoping that he's kind of happy with his removable denture. Ways forward, if he's not happy, we can consider, you know, proper mini implants. We can consider a kind of a removable bridge, so a bridge which is made of better materials on implants, which is removable, or we can go down the All-on-4 route. Okay, there's different price points for all of these options. It's all about finding something that works for the patient. So when you're thinking about getting a full mouth done, it can be really, really tempting to go somewhere relatively cheap. Okay, you can save tens of thousands of pounds that way. And I hope that not every single situation is exactly the same, but every time someone has come in to see us, and I'm just showing you a fraction of the problems that we see, every single time the story is almost the same. The patient has done a lot of research. They've gone to a place which has used the best materials, and hopefully in this video you've realized just by saying you use zirconia or Straumann, it doesn't mean that you're getting quality. And they've always been recommended. All these voices, non-dental voices, you know, everyone becomes an expert if they've had their teeth done abroad. And, you know, they're all saying, oh, I went to this amazing clinic and it was really, really great. You know, people saying that, I hope that they have got a really great result, but they're not seeing their result through the eyes of a dentist. They're seeing the result of what they see in the mirror, okay? And remember, this guy was completely happy with the look of his smile. It was a whole bunch of other things that I was not happy with, because I know that if I'd done that, I would be getting problems 4 or 5 years down the line that I need to sort out. When you see a dentist more locally, you've got that reassurance that in the future, if there are problems, they're much more likely to be sorted out, okay? And there's much more regulation in the UK, and regulation increases cost and it increases safety. There are other situations where we have had to remove a whole bunch of failing implants. Patients have been left with recurrent infections and massive issues in soft tissue, that the soft tissue hasn't been closed properly. And a lot of these patients have tried to get legal advice to take the clinics to court, but being in a different country, they're completely protected. They know they can get away with this. Okay, the clinics out there, they know that there's no incentive for long-term care, and there are no consequences for doing a bad job. Okay, it's very different in the UK. So I don't want to come out really negative, okay, because remember that only the cases that we see are the cases that have been done badly, where someone is looking for active help because they're in a worse situation than where we started. I hope that there's far more people who are completely happy with the quality of the result that they've got. But if you're thinking about getting this kind of stuff done, I think it's important that you see some of the downsides as well, okay? And it can happen in any country. I think it's important to kind of go around and find someone who is experienced. If you want something done properly, find someone who is experienced. Price, of course, that matters, but experience, I think, matters more, and aftercare. I recently spent over £50,000 on some building work. The aftercare wasn't really what I had expected for spending all of that kind of money. So, I shopped around and I found somebody else, and the aftercare with the second builder has been absolutely amazing. We all make mistakes, okay? Nobody can be expected to go into something they don't know about, as in, you probably don't know anything about dentistry, and expect to make the right decision. But all I'm saying is, do a bit of research, maybe go see a few people, and maybe make a decision based on more than just the cost of the treatment. So I hope you found this useful, guys. If you have questions, comments, please leave them below, and I do try and read everything as well. And remember, you can follow me on Instagram. I'm a little bit more responsive because I get notifications on the messages on that platform. All right, guys, take care.